Historically, when people talk about getting a prostate check, people think, well, the doctor put his finger up your bum.
Mm.
That no longer necessary. That is no longer necessary.
Right.
You can opt out of that. Prostate cancer check is just a blood test.
Mm.
You request your blood test from your GP. Once you, according to the guidelines, so if you're a man over the age of 45, you can request, it's called a PSA blood test, and PSA means prostate specific antigen test. So it means that they draw blood and it's, so they draw the blood from your arm, just like any normal blood
Yeah.
test. And they test it and it should show either positive or negative. The test is not 100% foolproof. You can get false positive, you can get false negative. So the advice is to have the test at least annually.
Okay.
So from you get
Right.
to 45, have you?
I
Ideally.
So those are the
Yeah.
guidelines,
Those are the guidelines, yeah.
right? Me personally, because in these conversations, I'm coming across men younger than 45 diagnosed with prostate cancer. So I would say, if you can, and if you have a family history of either breast or prostate cancer, try and get it at least 35, 40
Right.
and have it regularly.
Yeah.
Have the test regularly. Unfortunately, sometimes you go to the GP and ask for a test, even though you're at age 45 with a risk of prostate cancer in your family. You go to the GP and ask for PSA test, and the first thing they'll ask you, do you have any symptoms? And they say you
Yeah.
don't really need it. Prostate cancer doesn't necessarily show symptoms. You can have prostate cancer and have no symptoms. By the time you start showing symptoms, it could be too
It could
late.
be too late, yeah. So push for it.
So, if you ask your GP for a PSA test and they tell you no, politely insist. Don't get on like an old ragamuffin. Politely insist.
Yeah.
Explain to them, especially if you're a black man over the age of 45, there's a history of prostate cancer in your community.